Some common new user questions. How long? How long depends on what you're trying to accomplish, and how often also depends on what you're trying to accomplish. Whether you're using a plate for feel good or you're using it for feel good, that will determine the amount of time that is adequate for the benefit that you're trying to achieve. If feel good is the goal and you're coming from a chronic place, I recommend starting with low intensity, a little bit of a faster speed, and keep your durations short, under 5 minutes, even 2 or 3 minutes, and use your plate more frequently as symptoms present throughout the day, and build from there. If you're looking at fitness, the length of a workout is going to really depend on the number of positions that you're putting into it and the amount of effort that you're putting forth. If the goals are weight loss, strengthening, toning, you know whether you're putting effort forth or not. And if you need some help aligning appropriate exercises to the type of goals that you're trying to accomplish, there's lots of different sessions that Lifepro has offered. If you've never worked with a personal trainer, you're coming from a place of inexperience, not really working from a basis of exercise for purpose, you may want to work with a trainer and help out identify some goals and some appropriate positions for your body type and long-term success. Other common questions when you first start using a plate. If for any reason you experience pain, fatigue, joint pain, swelling, there's 9 times out of 10 people overdo it when they're starting out in one of 2 ways. They go the max time. I see comments all the time on social media, well, I only went 10 minutes, I only went 15 minutes. If you're coming from a place of poor health or you're just deconditioned, 10 to 15 minutes is often the maximum time on your machine. Why are you starting at the maximum time? Where are you going to go from there? Just going long durations and standing passively on a machine is going to give you some benefits, but long term, it's not going to give you the big, hard fitness benefits that you may be hoping to achieve. Other common newbie questions. Itchiness is a big one. Itchiness or tingly, like a pins and needles where your skin has fallen asleep or something of that nature. That is very much related to an increase in circulation and lymphatic movement. If you are dealing with compromised lymphatics or poor circulation, I recommend as well, for a number of different reasons, be conservative on your time and your intensity. Wide feet is maximum impact. Reduce those feet, reduce the time, and give your body time to become assimilated to the increased flow in circulation and lymphatic flow. A vibration plate, if it does anything effectively, it gives you a turbo boost of circulation and lymphatic movement. And if your body's not equipped, or you've got blockages or sluggish lymph along the way, you want to make sure that you're not doing too much too soon. And if you're overdoing it on a vibration plate, the symptoms are going to be very similar to if you overdo other activities or therapies. You might be tired. You might have a little bit of muscle soreness. You might have intermittent swelling in new or different areas. You may have a short-term weight gain. You may have a short-term weight loss. Listen to what your body is telling you in conjunction with any underlying conditions you may already be familiar with. But a vibration plate is going to present, if you overdo it, very similar to what you've done with other activities. The good news is it has super capacity to help boost recovery. So if you have overdone it, your first couple sessions have left you feeling sore, reduce time absolutely on your next session, but a minute or 2 will help you resolve and help boost that recovery piece. You shouldn't be uncomfortably sore. If you're dealing with a deficiency and your knees hurting or your back's hurting, or you feel the machine has done something to you, that 9 times out of 10 is related to overuse or too much intensity. Standing too wide for too long or too tall. If you're dealing with bad knees and you've just got a slight bend, there's a lot of movement and there's a lot of impact, similar to jogging, as indicated by the marker on many of your machines. So if you're dealing with hypermobility, inflammation, arthritic joints, anything of that nature, reduce intensity, reduce time, and use the machine more often and build up from there. Anything that the machine has left over the next day in the form of a poor experience, 9 times out of 10 is related to taking on more than your body is simply ready for. The itchiness that many experience, as I said, is an increase in circulation. Your body also has huge capacity to boost detoxification as we increase that lymphatic flow, so it's a little bit of that. If the reaction is extreme, you're very, very itchy, you're breaking out in hives, you feel like you're having some type of allergic reaction, it could be that you've overdone it or taken on more action than you're ready for. But for some people, there are underlying conditions where an increase in activity or therapy creates, your body pre-releases histamines as a response, and you do actually have, to a degree, an allergic reaction. There's a condition called MCAS, mast cell activation syndrome. Some of my folks with POTS are dealing with this elevated histamine response. So if this is something that you knowingly deal with when you are experiencing other activities or therapies, take whatever steps you normally would do. But if you have a severe reaction, especially if you have any lymphatic issues, it's not uncommon to have this underlying condition of MCAS. I would have that discussion further with your doctor as to what is the best approach. But another reason to use your plate in short, low intensity durations starting out. Be conservative, not slow in the form of a speed, but use it more frequently in short sessions. Keep that lymph and that circulation going, but don't do so much that rest of circulation tips you the other direction. So just something to be aware of. Other new common user questions. You may notice an improvement in your sleep. You may notice a reduction in your sleep if you've done too much or too close to bed and you've exhilarated yourself. But for the most part, people are experiencing better sleep. Symptoms like restless leg, those types of conditions, are often alleviated with just a couple of minutes. Again, a short spot, more feel-good session prior to bedtime to relax those legs, get a surge of circulation and lymph through. Many people are experiencing more restful sleep and better quality sleep as well, deeper sleep. For those of you that may be finding it has kept you up, you've probably done a little bit too much the night before. Increased urination or bowel movements, better constipation and incontinence is a really popular reason people are using vibration plates. And if either of those are a problem for you, it's not uncommon when you first start out and things get moving that you may have a couple of extra trips to the washroom. So please be conservative for that reason. If you're heading out somewhere, don't overdo it just before you head out the door. If constipation is an issue, there's a number of different ways, from standing or sitting directly on the plate, adding Kegels, all these different things you may be doing now to address these conditions can certainly be something that you can incorporate into your vibration plate time. But it is a very common pleasant benefit, side benefit versus side effect when you get things moving properly to have an increase in urination or in relief in your constipation. Know that these things, with consistent use, proper other complementary self-care, make sure you're drinking enough water. Many of these things, your body will retain and hang on to fluids very often when you're not giving it as much as it needs. So the vibration plate isn't going to cause these, but as your body becomes improved in its flow, in its systems, things will take time to normalize. And usually within a couple of weeks of regular use, things level out. The itchiness, if you're experiencing that, intermittent swelling, short-term weight gains or weight loss, If you stick with it the first couple of weeks, many of those are more related to our body's internal systems, and as they become accustomed, you'll notice most of these things dissipate after the 2-week mark. If they persist beyond a couple weeks, 9 times out of 10, you're still doing too much. Be conservative. I'm glad you're excited. It feels so good when you're using it. It's hard sometimes, but I do recommend shorter durations and using it more frequently for those reasons. Other common new user things I can tell you. For those of you that are dealing with chronic issues, it's not uncommon to have a burst of energy and strength, and that's a good thing, but I do discourage you from taking on a whole bunch of other stuff if you're a new user. One of the common complaints I get the next day related to maybe you're feeling tired or you're feeling sore isn't so much related to the vibration plate, but because you felt so incredible after you used it, you went and did a whole bunch of other things. You vacuumed the house and did all the dishes and painted the fence. And often when you're dealing with chronic issues and you're lacking energy and you're stuck dealing with pain and these awful symptoms all the time, it's empowering that you have energy and you're pain-free, but you tend to do too much. So if the machine is giving you relief, and it very commonly will, please just be patient. Don't take on a whole bunch of other extracurricular activities just because you feel that you can. Give your body the same amount of time as you would a medication. Give it 3 weeks to a month, and you'll start noticing the energy levels sticking around, the stamina, the strength. Some of those things are crossing more now into that mid and long-term benefit range. For the same reason, for those of you that are dealing with energy levels that go like this, chronic fatigue, those types of things, if you're in pain all the time and you're dealing with symptoms, it wears you out both physically and mentally. 2 to 3 minutes on your vibration plate, be that standing or seated, is a great way to give your body a boost of energy. Maybe before you're heading out the door going to work, or heading out for lunch with a friend, or maybe you're heading to other activities or therapies. So using the plate in short, more frequent sessions. For my medical professionals out there, it's about dosage. Many of my medical pros are using a plate prior to other treatments for 2 to 3 minutes. It's going to get the circulation moving. It's going to warm up the body temperature. The muscles are going to, be more ready, able to perform the therapies that you do after them. Think of a vibration plate as a catalyst. It's going to better prepare the body for whatever you may do after the fact, whether that's another activity, maybe you got to sit down and write a blog article, or maybe you're doing other therapies. Many of my pediatric therapists that have been using vibration plates know that a vibration plate boosts balance and sensory sensation. There's all these things that aren't necessarily clearly defined in the research. A lot of the research is very, singular in its focus, but many people that have been using these plates, like I have for almost 2 decades, the benefits. The anecdotal and the empirical evidence is overwhelming, be that from bone density to sensory to cognitive. When you move and you are more active, we know our body and its functions are going to work better. It's just logical. A vibration plate is just a way to be active that happens to be more effective in less time and a little bit kinder to you, the user. Let's talk contraindications very briefly. Contraindications are probably one of the biggest discussions of debate. And the reason for that is everybody's got a completely different list. There is not one definitive list of contraindications for a vibration plate. Just like there's not a contraindicative definitive list for activity. It depends. So contraindications, general ones, most manufacturers, including Lifepro, are not medical providers. They are not there to provide you medical advice. But there are trainers like myself and others out there that are well versed and use and support many in the medical realm. So when you're dealing with someone experienced that understands vibration plates and how to apply it to the body in front of you, there really are no contraindications to using vibration plates because there's no contraindications to being active. In between, there are modifications that sometimes need to be made for the body. General contraindications that you would have heard of. First one I'm going to start with are blood clots, varicose veins, venous insufficiency. Contraindications are not a contra can't do or contra do not do. They're a contraindication, and they are simply an indication to seek further clarity with someone that's more familiar with your biology, your doctor, your therapist. So if you're dealing with blood clots, known blood clots right now, an increase in circulation, be that from a vibration plate, jogging, going swimming, presents a risk of the clot moving. To what degree you should be active is a conversation you should have with your care provider. If your care provider is not familiar with a vibration plate, I want you to proceed with extra caution and some common sense. This is one of those times if you are dealing with blood clots, it's not my decision or it's not a yes or no whether you can use the plate, but you do need to be mindful and listen to what your body is telling you. Keep durations and intensity low. If your doctor has cleared you to use your vibration plate and you have current blood clots or known blood clots, keep your intensity low and your durations short, because we don't want a huge surge of circulation. That's really the risk. Not so much the vibration plate, but its ability to turbo boost that circulation and lymph. So we want to make sure there's not a risk of things moving. If you are at high risk also, or currently dealing with kidney stones or gallstones, guess what? When you move, those things have the potential to hurt. It doesn't mean you necessarily cannot use a vibration plate. Again, your experience, your tolerance all comes into this equation. But if you are dealing with a painful passing stone right now, it may not be the best time to get on something that shakes you about for 10 to 15 minutes. That being said, you are walking around, you are performing your function. There's nothing wrong with perhaps modifying and using the plate seated to take that area out of the equation. Maybe you still want to benefit from a little bit of lymphatic movement and circulation. It's the intensity of your time on the plate, how aggressive the positions are, how aggressive the settings are that are the variables. So talk to someone with more experience like myself or your care provider and see to what degree it is appropriate for you to be active. The plate is just a means in which you can be active, but keep those durations shorter. Other contraindications, common ones that come up, are pregnancy. If you are an existing user and you have been using a vibration plate for a very, very long time, you kind of wonder, should I keep using it? But your instinctive gut tells you, well, why can't I? You question. If you are a new user, have never used a vibration plate in your life, and you've recently become pregnant, I don't know what your preferences are. I don't know your level of conditioning. I don't want to tell anyone the risks are greater, but typically when you get pregnant, you don't start marathon running for the first time. You don't take up, different sports for the first time. But it generally is okay to keep doing the activities that your body is used to. So I always use the example, maybe you're a long distance or a sprinter, or you just like to jog. Do you stop doing those things just because you've become pregnant? Probably not. I've never heard a doctor say, stop being active, stop doing your activities. But you may need to modify the intensity of your activities, the frequency of your activities. Maybe you're not running for 10K, maybe you're strolling fast for 5. So you can modify the type of activity based on how your term is progressing, any risks. Same goes for a vibration plate. It's not necessarily a definitive yes or no. It really depends on you and your own unique situation. With pregnancy, again, a discussion to have with your care provider. It is on most contraindications because most equipment providers, not just Lifepro, most equipment providers are not going to be wanting to give medical advice to someone that is pregnant. So have that discussion with your doctor. They know your unique situation, your tolerances, and if there are any perceived risks with your activity in general, you guys can have that discussion and monitor things as you progress throughout your term. For my new moms, yes, absolutely, just like returning to your activities, you absolutely can use a vibration plate. I, for one, can speak, having used a vibration plate through my second pregnancy with my daughter. I wanted to get moving. I used my plate through my entire pregnancy, but I did modify what I did as I got bigger in term. Post-pregnancy, it was a mood thing. I was sad all the time if I wasn't on it. I craved it. So for me, a lot of it was, of course, the fitness aspect, getting back into shape, but it was the mental. It really helped me with my mood. It made me feel better. I did a lot of nursing just sitting on the plate with my daughter. But again, my body had already been using a vibration plate 11 years at that point. So it's all about what your body may or may not be conditioned for and the risks for if there are any with your own unique situation. Other contraindications, and I wouldn't really call them contraindications, but more points of clarity. If you are dealing with a chronic illness of any kind, you are in a post-surgery situation, a vibration plate is equally effective as a recovery or a therapeutic tool as it is an exercise tool. What you are able to perform on it is very much going to be dictated by your doctor or your care provider. So are you able to bear weight? Should you be sticking with low impact activities? A lot of times when you're recovering from a surgery or an injury situation, or you're dealing with a chronic issue, it's just a matter of modifying what you're doing on the plate as far as positions and appropriate settings for your tolerance and where you're at in your healing journey. A plate is equally effective for symptom management as it is for exercise. It's the times, the durations, and the intensity. Consistent use is absolutely key to achieving the benefits, whether those are on the feel-good and symptom management side or the fitness side. Consistent use is the key.